one. And good evening, everyone, and welcome to this episode of the AskDrMJ, Your Health is Important, Facebook and Instagram live broadcast. We are so glad that you have decided to join us here on this holiday evening because we know everybody is preparing to enjoy friends and family tomorrow. You're probably prepping your food, getting ready for, the fine dining experience. We want everybody to enjoy themselves. We want to make sure that you maintain good health while doing so. So thank you for joining us this evening. We know you have options and things that you could be doing, but you chose to be with us. So we want to make it worth your while. This is a special holiday edition of the Your Health is Important broadcast. We're not in our usual broadcast studio. I'm actually with family, my daughter, who was kind enough to allow me to set up a temporary studio so that I could visit friends and family and still bring good healthcare information to you. So thank you once again for joining us. As you know, this is the holiday season, and what we want you to do is enjoy it full. We want you to eat. We want you to drink. We want you to be merry, but we want you to do these things in moderation. This is the time of year when if you don't pay attention to what you're doing, you can put on 15 pounds very, very easily. So first thing I want you to do is weigh yourself when you get an opportunity to get your starting weight and make sure that you're staying on top of your food intake. This is the time when most people will get at least seconds on a full plate of meal. There are multiple dessert options, and then you're snacking and eating and drinking oftentimes high calorie drinks that have basically nothing but cheap calories in them, but they can put weight on you. Now, a lot of people like mixed drinks, sweet drinks, etc. So it's very, very important what you drink and how you choose to drink it. Now, one of the things that everybody seems to be becoming aware of now is that tequila is a very actually good cocktail to drink. Straight up, you can drink it without anything, but if you mix it with something, make sure you're mixing it with something that's not full of calories. One of the highest calorie drinks that you can have is a rum and Coke. So you have rum and you have a Coke or a Pepsi with it that's high sugar, high calories, etc. But surprisingly enough, even though tequila is one of your best low calorie, low carbs cocktails that you can have, the main cocktail that's made with tequila, the margarita, is the highest cocktail content that you can have. So if you like margaritas, you got to be very, very careful with your intake of those things because they too can create problems as far as weight gain is concerned. You don't have to necessarily eat a lot. You can drink a lot of your calories at this time of year. So drinks that have multiple mixtures in them and syrups, those things that taste good, taste sweet, probably are very, very high in calories. And so, of course, you have to be careful with any cocktail that mixes with a soda. But remember what Dr. Collier says about moderation. To keep yourself from becoming dehydrated and to get impaired by the alcohol, whenever you drink alcohol or anything other than water, this could be Coke, this could be sweet tea, this could be iced tea, this could be lemonade. Anytime you're drinking anything other than water, you also drink a glass of water. So you get one glass of one substance, one glass of another substance. And when you finish that glass, you make sure you finish that water before you get a refill on it. If you get a refill on your primary drink, then you also get a refill on the water. That way you will be hydrating in real time and you will find that the alcohol doesn't have a negative effect on you. You don't feel hungover the next day. You don't feel brain fog. You don't feel any of those things because you're flushing it out and you're only drinking in moderation. So what's in moderation? 2 cocktails are in moderation, but everyone exceeds that during the holiday season. There's a lot of good sports going on this weekend. There'll be a lot of great basketball and football games, college and pro. So, most people, they really start imbibing with alcohol probably about noon. And you can literally drink from noon to midnight with football going on. So very important that you don't do that. Or if you do, you make sure you're drinking plenty of water, like I said, but also that you're on low calorie snacks. Nuts, popcorn is better than chips and dip. So nuts, virtually any type of nut is very, very good for you. And get popcorn, it takes up a lot of stomach space and has virtually 0 calories in it. So it is a very good option as far as snacking is concerned. But if you sit there and go through a couple of dozen wings,
And then, you know, when you're using ranch or blue cheese as your sauce, those sorts of things, that's a lot of cheap calories. And you may find that by the time this weekend is over, you gain 5 pounds. So what do you do to get that 5 pounds off? I call that 5 pounds that you have the option. You can have that stick to you, or you can get rid of it almost immediately. One of the ways you can do that is use the Lipo Drops Maximum formula. And if you add the Lipo Nights to it, you're really going to metabolize those calories, metabolize that fat so that it is not stored in your body. And you'll find that even though the potential was there to gain 5 pounds, that you would not have gained any. If anything, you might lose between now and then. But during the holidays, you got Christmas parties that will be coming up. You got parties with your jobs. You'll be hosting parties in your home, going to your friend's home. There's a lot of eating that can be done between now and then. So be careful and conscientious about what you're doing. We want to get through this next 6 weeks and do well. So don't wait until January and make your New Year's Eve wish and then decide you want to try to start to lose weight. You can do so right now. And with our Black Friday sales that we have on every product, 65% on every product that's on the website, you can lose weight. But don't forget the new products that we have. We have the Lipo Tea for men, the Lipo Tea Men that changes your life. Now understand the Lipo Tea is it's a tablet. It has medicine in it. I'm sorry, it's a supplement. It does not have medicine in it. Let me be clear on that. It's a supplement that makes your body increase your testosterone levels, increases your libido, and enhances your sexual function. This is not a tablet like the medicine Viagra. You take Viagra and 20 minutes later, you have an erection and you're good to go. Lipo Tea does not work like that. What Lipo Tea does is improve your baseline function. It's like joining the gym. After you've been working out for a few weeks, you're in better shape and you do better and you work better. Well, that's the same thing with the Lipo Tea. After a few weeks, you do better and it works better. So you do well. So because the ladies were asking for, where's our Lipo Tea? Where's our Viagra? We don't have anything that helps with our sexual function and enhances our libido. Well, now we have the Lipo Hers. Lipo Hers has been an amazing product. Women are getting it and purchasing it, and they find they have enhanced sexuality. Their vaginas are thick, their vaginas are wet, their vaginas are moist, they are ready to receive and have intercourse. But more importantly, their sex drive is enhanced. So they feel like they are more stimulated. They have more intense orgasms when having sexual intercourse. So this is key. When a woman is enjoying herself during the sexual process, a man will always enjoy himself. And when you have a mutually satisfying sexual experience, then you find that you're doing that more often. It enhances the nature of your relationship. Men are enjoying their female partners more. Females are enjoying their male partners more. It's not just 2 minutes of hard work and get off me and let me go back to do what I was doing. You really have an intimate experience that enhances your relationship, your interpersonal relationship. You feel that spark like you did when you first got together. It literally can change a stale, dull relationship into one that now has got that fire again. So the Lipo Her is absolutely amazing. Now, we're also in the cough cold season. So remember, we got 2 new products for that. The Lipo Shrooms, which is a mushroom product, which is absolutely incredible in boosting your immune system function. But more importantly, people are always asking me now, I'm having some, I'm forgetting things. My short-term memory is not what it used to be. I'm concerned about getting dementia. I need something to enhance my brain function. The Lipo Shrooms is just that product. It will give you that benefit in addition to boosting your immune system and giving you just vitality and making you feel great. Mushrooms have been used by a variety of different cultures, particularly Native Americans, as a medicinal product and as a supplement to enhance spirituality, lifestyle, mental alertness, etc. forever. We are just discovering this. And of course, we got Dr. Sea Moss, and the sea moss has been a product that everybody's been asking about for years. People, every time I do this show, somebody asks me about sea moss. So we said, you know what? Let's make sure that we have a product that's available, that is high quality, that has been studied, evaluated, make sure that it gives you all the benefits with no potential side effects, and that it is easily mixed with other supplements as well as any prescription medications that you may be taking. So that's the full product line right there. everything. Black Friday sale prices going on right now. You can go to the website, lipodrops.com, get the Dr. CMOS, the Lipo Shrooms, the Lipo Drops Maximum Strength, and the Lipo Nights. In combination will make you not only not gain weight, but hopefully lose weight during this holiday season. You don't want to start off in January 15 pounds heavier than you are right now, because that at this point in most of our lives as a more seasoned citizen, if you're 40 or older, you can't lose weight the way you used to. It's not easy. Back then, you could drink an extra glass of water a day and you could lose 5 pounds in a week. You can't do that anymore. Your metabolism has changed, your body has changed, and your body's desire to lose weight. Your body has a thermostatic set point for your weight. And whenever you try to get below that, there's a hormone called ghrelin that tells your body to get back to that set point. So it is not that you have no stick-to-itness, no fortitude, that you can't do anything, you can't stick to it when it's time. That hormone literally makes you lose weight, which is why the average diet, the person will lose 15 to 20 pounds, and then that hormone kicks in and you gain back 20 or 30. And so that hormone is a big problem, and that is always the case when you're losing weight by restricting calories and caloric intake. That is the methodology of every strip mall diet that is out there. That's the quick weight losses. That's the weight be gone, the I'm too fat, the Jenny Craig's. All of these places control your caloric intake. And guess what? They all work. If you do exactly what they tell you to do, you will lose weight without question. It works virtually every time. The problem is that when you go back, when you stop doing those things to go back to your usual eating habits, you will gain the weight, because guess what? You have lost the weight by restricting calories, but you have not altered your body's metabolism. That is the difference in the Lipo Drops and the Lipo Drops Maximum Formula and the Lipo Nights. These products alter your body's metabolism, change the way your body metabolizes food, particularly fat, stops your body from storing fat and allows you to metabolize it. And it changes everything. It gives you more energy. You feel lighter. Your muscle mass increases. Your body fat decreases. So your body changes in a positive way. When you have a calorie restricted diet, there's a ratio of muscle to fat for every pound that you lose. It's basically, if you lose 15 pounds, it's basically 10 pounds of muscle, 10 pounds of fat and 5 pounds of muscle. And so the problem is you don't want to do that. With the Lipo Drops line of products, the way it alters your metabolism, then your weight loss is 90% fat only. So it's very difficult to gain the weight back because you've lost fat, and that's what your body wants to lose. And the muscle mass requires a higher metabolic process to sustain itself. So as your metabolism changes, it's easier to maintain your weight loss. So you've lost the weight, but everybody wants to maintain it. I tell people I can get virtually any amount of weight off of you in some period of time, depending upon, number one, how much you want to lose. Number two, how quickly you want to lose it. Number three, how many products you're willing to take to accomplish that objective. And what you find out is that the more products that you take, there's a higher level of stimulation of your metabolism. You lose more weight quicker. But you can use baseline products and you will still lose weight over time. It's just a question as to how quickly. Virtually any of our weight loss products will give you a 5 pound per month weight loss. The objective is that's 5 pounds of fat, not 5 pounds, not 3 pounds of fat and 2 pounds of muscle. So over time, your weight loss is greater and you look better. But if you get multiple products, that weight loss will be magnified. You will lose 10 pounds, 15 pounds per month. And that is where you want to be. You want to lose, everybody wants to lose as much weight as possible in as short a period of time as possible. And that is how you accomplish that objective. Okay, Holly, thank you so much for allowing me to introduce. Let's see who we have on with us right now. Let's do our traditional roll call. Sean Big Time Green. Thank you, Sean, for tuning in. I know you're in Louisiana and you have not missed an episode yet. So thank you for being here with us. Okay, Deborah Mathis from Denton, Texas. Deborah, thank you so much for being here as well. We appreciate you because I know you getting ready for Thanksgiving as well. Rachel Harrison. Hey, Rachel, hello. How are you? Thank you for joining us tonight. Okay, Patrick White. Good evening, family. One love. One love. We are here with you, Patrick. Thank you for being here with us. Sherry Gamble from Dallas, Texas. Sherry, thank you so very much for tuning in from Dallas. Donna Hawkins, good evening. Thank you for being here as well. Jennifer Monroe McKee from Jackson, Mississippi. Hey, Jennifer, thank you for joining us here. We appreciate Jackson being in the house. Valerie Patterson, good evening from Nashville, Tennessee. Hey, Valerie, thank you for being here as well. Okay, Ursula Clark Holmes, we love you back. She said, hey, we love you. We love you back, Ursula. Thank you for tuning in. We know it's a holiday, and we're glad you chose to join us. Miss Diamond Page Hall from Cocoa Beach, Florida. Thank you, Diamond. We appreciate you for being here as well. Chili Wheel from Stockbridge, Georgia. What's up, Dr. Kaya? What's up, Chili Wheel? Glad to have you in the place, too. I love all my male followers. Derek Griffith, hey, from Chicago, Illinois. Hey, Derek, how are you, sir? Like that profile picture. Okay, Cheryl Simmons from Montgomery, Alabama. Hi, Cheryl. Thank you so much. So we got Alabama, we got Chicago, we got Detroit. Barbara Brown from Chicago here, another Chicago. And thank you, Barbara, for joining us. And you guys you're an hour behind here, so you still got plenty of time to prep your food, and you can even prep while you're listening. That's what a lot of users are doing. I know that this is a temporary studio here set up at my daughter's home, and everybody's in the kitchen prepping food and doing it. Thomasine Morris, happy Thanksgiving from Birmingham. Thank you very much, Thomasine. We appreciate that. Okay, Ann Wells from Fort Lauderdale, Florida, one of my favorite cities of all time. Really enjoyed my visit to Fort Lauderdale. Looking forward to coming back. Audrey Hill, Audrey Nunn, Chicago love you. We love you back, Chicago. Chicago's in the house, and thank you so much. The Midwest, Chicago's in the Midwest. I bet it's that cold air has hit Atlanta in the last few hours, so I know it's cold up there. Shirley Paul from Missouri City, Texas. Hey, Shirley, how you doing? Thank you for joining us. All right. Okay, Holly, let's get to some of our questions. Will Jason, I got symptoms of AFib. Anything I can do to try and lessen symptoms? Thanks. You can, but Will, you need to confirm whether you have AFib or whether you just think you have it. If you have AFib, you need to be on a blood thinner, but that can be corrected. There are prescription medications that can slow the heart rate down. And when atrial fib, when your heart is pumping, let's look at it. You got the atrial and the ventricle. It goes like this. The atrial pumps, the ventricle pumps. Atrial pumps, the ventricle pumps. Atrial pumps to the bottom of the heart, the ventricle pumps to the rest of the body. We call that the lub-dub, lub-dub, lub-dub. That's the heart sound your heart makes like that, like that. Now, when you have atrial fibrillation, the top part of the heart is called the atrium. And so instead of pumping and sending a full load of blood, let's say a cup of blood down to the lower part of the heart pumps out a cup of blood. Now, the atrium is doing like this. And so the blood is barely moving or not moving forward. And when blood sits still, blood clots. When blood clots, you get problems like heart attacks and strokes. So there's back pressure coming in from the rest of the body as the veins return blood back to the heart. So some blood is moving forward, even with atrial fib, it'll go to, but it's not the quality and volume that you need to sustain yourself and move oxygenated blood around your body. So you need to confirm whether that's the case. If it's just symptoms of AFib, then there are lots of things you can do. But I would recommend at minimum that you take a low dose aspirin, 81 milligrams. We used to call them baby aspirin. Now we call them low dose aspirin. As far as that is concerned, but that needs to be evaluated. You need a baseline EKG. Sometimes even things like smartwatches can tell you whether you have an atrial fibrillation or not. But I'd recommend don't mess around with it. If you're having symptoms, go to the doctor, get a comprehensive physical examination that would include an EKG. And then you can answer that question. And then if you need to be, again, there are medications that can control the heart rate. Sometimes they literally have to shock your heart, just like when you've had a heart attack and you see them, they put the paddles on your chest and say, clear. They do that to shock your heart and reset it, just like you reboot your computer. And so instead of that top part of the heart fluttering like that, they shock it, they say, boom. And then all of a sudden, doom, 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 lub dub. You back in the rhythm. Sometimes you get shocked one time and that's the end of it. Sometimes you have to get shocked multiple times. If the shocking, which is electroconversion of the heart, does not reset you permanently, then sometimes you still have to stay on medication to prevent yourself from going back into AFib. Or now they're doing a thing called ablation. They basically block the nerve that tells the heart, that stimulates the heart to go into atrial fibrillation, and blocking that nerve cuts off the off-on switch. But the heart has an innate rhythm that it will revert to So it doesn't need to be told to pump. It will pump spontaneously if you block that nerve. And so when that happens, you are basically feeling just fine. Again, you don't have the symptoms of atrial fib. But if you've seen the commercials featuring Kareem Abdul-Jabbar, there are a lot of symptoms associated with it. But the main thing is that you don't have to have any symptoms. And if you're actually having atrial fibrillation, you are susceptible to a heart attack and a stroke. So it happens all the time, and you don't want to be a survivor or worst case scenario, die from a heart attack or stroke that could have been avoided. Okay, next question. Mary Hatton, okay, with herbs or food, or do you recommend to bring platelets down? This is an inflammatory disease. Can you tell me what can cause this issue? Okay, that is correct. Inflammatory and a high amount of platelets causes clotting. So two things you can do that are supplements. One, vitamin D is your body's natural anti-inflammatory. So vitamin D at a dose of 5,000 international units per day, which is a difficult dose to find, but we have it, and it is a purified product. I take it every day myself, the Doctor's D on the LipoDrops website. And then omega-3 fish oil is also very good for that. So that hopefully will help bring the platelets down. Some people have a genetic predisposition to a high platelet count, and they actually have to do something dramatic, is donate platelets. So you go just like you give blood, but they also take platelets out. Sometimes they'll take out so much blood, they'll give you the blood back and keep the platelets. This is a high value product as well. There are places that will buy those platelets from you because when a person has a clotting disorder and needs platelets, it's one of the most expensive transfusions that you can get. So I know in and around Atlanta area, they have at least 3 different companies that can do that. One of the local facilities is called BioLife, and there's another one, BioHeme, something like that. But you could Google it and find out. But again, the natural ways to do that, and you got time, there's nothing urgent about that. But I would also take a low dose of aspirin, 81 milligrams, to prevent clotting or decrease your susceptibility to clotting. So the anti-inflammatories would be the omega-3 fish oil and the vitamin D, and the low dose aspirin as well. But you need to monitor that, I would say, at least every 3 months to make sure that's no problem. Thank you, Mary. That was a great question. Chantel G. Hi, Dr. Collier. Not sure if you ever spoke about pilonidal cyst. If so, do you mind reposting? My 16-year-old has been dealing with this issue for a year now. Thanks in advance. Okay, a pilonidal cyst is a cyst usually in the Bartholin's gland of a female's organ. The outer labia usually gets inflamed. You have to open that up, or a pilonidal cyst can be in the inner upper cheek of your right above the gluteal fold. So basically at the top of your butt cheek, a pilonidal cyst there. I had a very unique experience when I was in my medical training. Doctor called me to the emergency room to assist him in removing it. It is literally like a balloon beneath the skin. You cut it open, you remove the balloon so that it does not recur. And oftentimes you do not close that wound. You pack it and you remove the packing slowly. And it's like a wedge. The bottom of the wound is like a wedge. And so as you remove the packing, the wedge fills up until it's flat. And now you got normal skin over there. That process can take weeks. And so it's a surgical treatment option. You can open it up and drain it to see what happens with that. If that takes care of it, fine. If not, and I drained them, I will give it 3 and you're out. By the 3rd time, you need a surgical incision. That surgical incision, instead of just lying down the middle, is an elliptical shaped incision like this, so that the walls are not together. And so that wound will open and drain. And when that happens, then it would just heal over time. And so that will require a reasonable amount of wound care in doing so. But then oftentimes you'll need to be on antibiotics as well to do that. And hopefully it will not recur once it has been surgically excised. So great question. Okay, Durondo Willis, black man, 310 pounds, minor health problems except for a fatty liver and type 2 kidney disease. Do you recommend herbs, detox, and the vegan diet? Anything else to consider? Yes, milk thistle is very good supplement for that. I think our lipo shrooms would probably be a good product for you as well. Type 2 kidney disease, if you mean chronic kidney disease stage 2, that's one thing. If you have type 2 diabetes and resultant kidney disease, that's another. But nevertheless, there's some things that you would benefit from, particularly weight loss. We need to get you under 300 pounds. There's no height at which 300-pound works. So no matter how tall you are, we need to get you under 300 pounds. And then that would be, you would need the LipoDrops Max, possibly the Lipo Nights as well. The detox, you want to take the Lipo Cleanse and the probiotic formulation as well. Those two things will help change your life, and that will give you the detoxifying that you are seeking. The D-Herbs Detoxifying, that is a brand product, D-Herbs, if that's what you're speaking of, that will detoxify you, but you can accomplish that with virtually all the products that are on the Lipo lines. A vegan diet, there are vegans that are overweight. So a vegan diet can be good, but you got to have a good protein source. And as a man with 300 pounds, you're a big fella, you need protein. And so a vegan diet might not necessarily be what I'd recommend, but you could definitely cut down on the red meat and get your protein more from chicken and fish. And so that will give you great benefit. But you need to form a partnership with your healthcare provider. This is not going to be an overnight cure with you, but we can do some major things in 3 months. If you get on a lipo line right now, 3 months from now, you'll come back in here and you should be 280 or less, hopefully around 270 to get you down. That will change everything. And again, with the detoxing that you would get from the Lipo Cleanse, that will definitely benefit you as far as removing toxins in the body. All are compatible with kidney disease, so that will not impair your ability to take those products. And that will also help remove some of that fat from your liver because your body will metabolize that fat. Okay, Durando, thank you. Great question. Corey Brazil, my lymph nodes in my throat have been swollen since March. What can I do to heal them? Your lymph nodes are your body's army. They contain soldiers, your white blood cells and lymphocytes that fight infection. So if you have swollen lymph nodes in your throat and they have been that way since March, then if they're inside that, your tonsils are lymph tissue. And so if you're speaking of inside your mouth or inside your throat, those may actually become so toxic they have to be removed surgically. The other, if they're outside, if we're talking about here, then that means that's an indication that there's an infection. So you could have a throat infection, or you could have some dental issues that are giving you chronic infections or dental abscesses. You could also have an ear infection that could cause those things. So when lymph nodes are swollen, they are indicating infection without question. And that's been going on since March. You need a course of antibiotics and an anti-inflammatory, and probably instead of a short course like 7 days, you would probably need at least 14 days to see if that can help that. But if not, that needs to be evaluated to see why you are having that problem. Because again, chronically inflamed enlarged lymph nodes are a clear indicator that infection is present. So you should get a CBC, a complete blood count, that will check your white blood cells as well to see if you have an elevated white blood cell count that tells you whether you have infection. A normal white blood cell count is from 5 to 10. If it's greater than 10, that is clear indication that you have infection. And the great thing about it is you take the antibiotic, it comes down. It's a clear indication that the infection has resolved. If it's something like a dental abscess, you can calm it down with antibiotics, but until you get definitive treatment, it'll come back and keep recurring. So people will do that when their teeth are hurting. They get some amoxicillin and the tooth stops hurting, so they don't do follow-up care because they think it's fixed and it is not. And so a dental abscess can start off as something very, very simple, but that infection can get into your bloodstream and infect your heart and cause all kind of problems from that perspective. So just a little swollen lymph gland starts off as telling you something is not right and it needs to be evaluated. Okay, Corey, thank you. Great question. Okay, Lisa Porter. Hey, Lisa. What exercise is best for those in menopause? Is cardio not good for menopause? Cardio is great for menopause. Cardio is great for everything. What you don't need to do is lifting. Dr. Collier has been saying this for 30 years, but now that somebody released a study about 6 weeks ago that confirmed everything that I've said and I've been saying, that you get more benefit from lifting lighter weights, or if you're going to lift weights at all, more reps with lighter weights, which is basically an aerobic or cardio type of activity or cardio exercise. And it does not have to be anything more glorious than walking. You don't have to run. Running is actually not good for your hips and knees. The difference in walking and running is when you run, there's a flight phase where both of your feet are off of the ground. When you walk, there's a smooth transition of your weight and one foot is always on the ground. And so you get the great benefit and the best benefit from walking. I did a study during the 1996 Olympics comparing a simple thing, the benefits of walking versus running. And everybody would say, oh, you assume that running has to be better. Well, guess what? It's not. One, because you will walk for a longer period of time and you're not as tired and you don't do damage to your knees and your ankles and your hips. So walking will be a great, but then you can do non-weight bearing. The elliptical is excellent for that. An exercise bicycle, particularly if it has arm motions as well, all great exercise opportunities. If you want to go outside, though, just walking. I recommend a controlled environment like a mall, because then it doesn't matter whether it's hot, whether it's cold, whether it's raining, whether it's snowing. It doesn't matter. It's weather control. You go inside the mall, but leave your wallet at home. Carry just enough emergency money for something, but don't, because if you carry money, you're going to go shopping after you walk, and I don't want you to spend money you wouldn't normally have spent. Or you're going to go to the food court and get one of those great giant American cookies or go, get one of those muffins or something that's high in calories, and you're going to erase all the benefits of your walking that you just did. So oftentimes malls will allow you to come in before 10 o'clock when they open to get your exercise. That's a great time because all the stores are closed and you can't spend any money. But get a walking partner, preferably that way on the days you don't want to do it. They'll say, oh, come on, we got to go get our walk in, and try to do it a minimum of 3 times per week, but ideally 4 times per week. One of the results of this study that I spoke about earlier was that the benefits of exercise are, if we give that benefit a variable value of X meaning you get X benefit times 0 if you're exercising 2 times per week. It's a total waste of time. And that's most often. Most people go to the gym 2 times per week. It is a total waste of time. If you go 3 times, you get 1X benefit. So if you go 3 times per week, Monday, Wednesday, and Friday, or some variation thereof, it doesn't have to be spread out, but just 3 times per week, then you will get 1X benefit. But guess what? If you go 4 times per week, you get 2X benefit. So you double your benefit of exercising. If you can go, my recommendation is Monday and Tuesday, Wednesday to rest, restore, heal, and benefit from the exercise process. Thursday and Friday, back exercising again for at least 30 minutes. And then on the weekend, you do whatever you normally do. You clean house, you do yard work, you garden, whatever, anything that burns calories. That is the optimal way to lose weight and to optimize your fitness level. Now, you do not lose weight in the gym. Let me make that clear. You cannot exercise enough to get any substantive weight loss in the gym. You lose weight in the kitchen. What you do in the gym is obtain a level of cardiovascular fitness. That is what your objective is. You want to be fit. You want to have energy. You can do all of those things and not lose a pound, but you change your body's metabolism and change your fitness, your physical fitness level and your cardiovascular fitness level by exercising. But again, 30 minutes is more than enough. We try to do it for an hour, but even if you go for an hour, by the time you socialize, change, wait on machines to become available, etc., you actually probably get a good 30 minutes of exercise, and that's perfect. So 3 times per week to get 1X benefit, 4 times per week to get 2X benefit. So people say, well, if I go 4 times a week and I get twice the benefit, what happens if I go 5, 6, 7 times? If I go every day, I have to go every day, Dr. Collier. Guess what? No additional benefit other than the habit of going. So if you're one of those people that say, if I don't do it every day, I'm not going to do it, then you do it. But you're not going to get more than 2X benefit for 4+ days. So 4 days, 5 days, 6 days, 7 days is basically the same amount of benefit as far as cardiovascular fitness is concerned. So you want to make sure that you're doing it. And 4 times per week is probably optimal for most people. They can't do more than that because life intervenes. You have to work. You have to spend time with your significant other. You have to spend time with your children. And you can't go to the gym every day. It just can't be done. You'll start off doing it, and everybody does. Most people, like I said, they buy a gym membership with plans on going 3 or 4 times per week. They usually go 2 times per week. And then when you're going 2 times a week, you're not getting any benefit anyway. So that is why people will then try to come to Dr. Collier and say, Dr. Collier, I need you to write a letter that says I can't go to this gym, or otherwise they're going to keep charging my credit card. Well, guess what? Dr. Collier is not going to do that because I do want you to exercise, but you don't have to do it at the gym. You can do it, like I said, a good exercise walking program. And if you incorporate stretching and you incorporate something like Tai Chi or yoga, you will be optimally physically fit. Great question, Lisa. Next question, Holly. Okay, Thomasine Morris. Hi, Thomasine, the hip hop doctor. I love tea. I'm damaging my kidneys by drinking so much. No, you are not. Tea is not bad for your kidneys, nor is coffee. Actually, there was a study that was done for people that drink coffee, and everybody assumes that coffee is bad for you. When I ask patients, do you drink coffee? They apologize immediately. So, oh yeah, I drink 1-2 cups every day. Is that bad? Well, this study showed that up to 8 cups of coffee actually has enhanced benefits. You heard me. 8, 5, 6, 7, 8 cups of coffee per day has great benefits, and it has nothing to do with the caffeine in the coffee. Everyone assumes that it is the caffeine. It is not the caffeine in the coffee. It is not the caffeine in the tea. There's something inherent in coffee bean and tea beans and tea leaves that has health benefits, so you can do that. But remember what I said at the top of the show. Whenever you're drinking anything other than water, iced tea, hot tea, Coca-Cola, Jack Daniels, Hennessy, whatever, you get a glass of whatever it is you're drinking, and you get a glass of water, and you finish that glass of water as you finish your primary drink. And if you get a refill on your primary drink, or you get a second beer, you also get a second glass of water. And if you finish that second primary drink, sweet tea, soda, beer, Jack Daniels, you also finish that glass of water. So it's a 1-to-1 ratio that will flush your kidneys out and make sure that there's no damage being done. That will also keep you hydrated in the process, no matter what, because teas and coffee and sodas can be dehydrating. And again, you'll know that your kidneys are functioning just well because you'll be urinating more. And people say, if I drink that much water, I'm going to be urinating more. Yes, exactly. This is a good thing. We want you to do just that. Okay, next question. Fellini Smith, good evening. What can I use to bring the color back to my legs? They are dark now from lymphedema. Fellini, I hate to tell you, it's going to be difficult to do that. There are bleaching creams and things that you can do that will can lighten the skin. But the lymphedema does causes hyperpigmentation or darkening of the skin, and that process is almost permanent. But as you lighten skin and your skin turns over, your skin does replace and replenish itself continuously throughout your lifetime. You are shedding skin. So it is possible if you use a good moisturizing product with vitamin D in the product that you're rubbing on the skin, and then if necessary, use some skin lightening products. But if you do it with the vitamin D moisturizer, and you don't have to spend a lot of money on this, I like to use the Suave, Suave brand. Suave brand with vitamin D. A large bottle is $6, $4 to $6, depending upon where you get it. If you get it at the Dollar General, it's $4. If you get it at Target, it's $6. But it's still a great deal on lotion. It's not $15 like you can pay for some of these other lotions. So, but the process is going to be a long process and an arduous one. You're going to have to keep doing that, and it's going to take probably 6 months for the skin to turn over. And then you have to keep the lymphedema under control as well. If the lymphedema is not well controlled, then that is going to be almost impossible to stay on top of that darkening of the legs. And then, of course, you don't want to do anything that's going to increase the darkening. So you don't want to go out and sunbathe, because that will cause even greater hyperpigmentation, which is basically what sun tanning is. So good luck with that, Fellini. Take a good anti-inflammatory. Again, you would benefit from the omega-3 fish oil, which helps with skin health in particular, and also vitamin D, the body's natural anti-inflammatory. Good question. Next question. Anita Juden, I'm from Mississippi. Is there a supplement for strengthening your core besides exercising? No, there's no way to strengthen the muscle other than exercising the muscle. But you don't have to do anything dramatic. You don't have to do 1,000 crunches while you're sitting there watching television or even watching me. You pull your stomach in. It's like you're trying to pull your belly button into your backbone. And you hold it for a count of 10, 1,000, 2, 1,000, and then you relax it. You don't bulge it out. You relax it also for another count of 10, and then you bring it back in and hold it for a count of 10, and that will strengthen your core. That one exercise will give you great core benefit. And every time you think about it, you do it while you're at work. And also you can throw in some Kegels as well to tighten up your vagina and your rectum so you don't have problems with urinary incontinence or stress incontinence when you cough, sneeze, or laugh, and that your vagina stays tight so you can enjoy sex more. And also control your bowel, keep your bowels controlled so that you can hold it when you need to. Okay, so those are great options for you, but there's no pill, no magic, no thing you can stick on your stomach, no wrap around that's going to strengthen that core better than that one exercise. That tension increasing exercise, again, feeling tight in your stomach as if you're trying to pull your belly button or your umbilicus into your backbone and hold it there. Hold it for a count of 10. Count to 10. 1, 1,000. 2, 1,000. 9, 1,000. 10, 1,000. Then just relax it. Do not bulge it or push it out. And then keep doing that. A set would be 10 10-second periods. Then you relax a little bit, and then you do it again every time you think about it. 3 or 4 days, you'll start to really feel that core starting to strengthen. After 2 weeks, you will have core of steel. That I can promise you. Okay, great question, Anita. Chili wheel. What is the best blood pressure medicine to be on, especially for Black people that won't mess with your sexual nature? Okay, chili wheel, blood pressure is a special science, but the medications that Dr. Collier recommends, because you've heard me say, I would never, ever, ever give a man a blood pressure medication that would inhibit his ability to have sex or impair his erectile function. Why? Because I wouldn't take it. Because, if I can't have a good sexual experience, then what's the point? Exactly. So the 2 classes of medications that I always start off with are calcium channel blockers. The most common is a medication called amlodipine. It comes in 2.5, 5 milligrams, and 10 milligram tablets. It is a vasodilator. What it does, if you have a pipe that's 3 inches big, like that, and you take a vasodilator, you make the pipe bigger. Now it's 4 inches big. It's got the same amount of fluid in it. Guess what? That fluid is under less pressure. That's how it lowers your blood pressure. The great thing about that is that a vasodilator, like the calcium channel blocker, amlodipine, increases blood flow to the penis. The mechanism of erection is one of blood flow. So you have more blood going into your penis. There are valves that close like the Panama Canal, and they hold that blood in there until you ejaculate. When you ejaculate, those gates open and the blood comes out and you lose your erection. That is what's supposed to happen. That is what does happen 100% of the time. So men be saying, oh, I can go all night. You can't do that. When you ejaculate, you lose your erection. That is what's supposed to happen. Now, you may have a short recovery time, which means you're back at it in 10 minutes, but you will lose your erection. That is what's supposed to happen. Plus, you can't keep holding that blood down in the penis. It can create some problems. That's called priapism, and that happens sometimes, and this is a medical emergency. When you hear them saying, if you take Viagra and you have an erection that lasts more than 4 hours, you need to call your doctor. You don't need to call your doctor. You need to go to the hospital because they need to open those gates and get that blood flowing again. So, but the key thing is when you take that class of medication, it gets more blood flow into the penis, so your erections are longer and harder. You could say that's a side effect. You could say that's a benefit of the medication. Dr. Collier likes to say that's a great option to have because nobody ever complains about their erections being longer or harder. Nobody ever says, Dr. Collier, I can't keep taking that medicine. It makes my penis too big and too hard. No, I think they enjoy that as a potential side effect. Other medications that I use are ACE inhibitors or angiotensin receptor blockers, ACEs and ARBs. They have a great effect on your blood pressure because they block the effects of a hormone that's secreted by your kidneys that makes your blood pressure go up under stress. So ideally, they do not bring your blood pressure down. They prevent your blood pressure from going up. That is a very important and significant difference. So they don't have necessarily a positive effect on your erection, although lowering your blood pressure in general is a positive effect for erection, but they will have no negative effect. So basically, by lowering your blood pressure in general helps improve your erectile function, increases your stamina, etc. Because your heart isn't doing this, trying to pump blood, which is what happens when you have high blood pressure. When you have normal blood pressure, your heart does this. It can do this for 100 years, just chilling, just chilling. But when you have high blood pressure, your heart is. And that is exercise, and that is work, and that is energy that could be utilized in other ways, like having sex. But when that energy is being utilized just to pump your blood and your blood pressure is high, then it takes away your ability to have a good, hard, firm erection and decreases your sex life. So that won't mess with your blood nature. ACEs and ARBs and calcium channel blockers. Some name brand ACEs and ARBs will be lisinopril, one of the most common drugs. Losartan is the first generation angiotensin receptor blocker, or ARB. Then there's olmesartan. Those are the big three that I like to use. There are others. There are 13 different ones. And so any of them would be good options. So I would more importantly choose the one that my insurance company will cover. And again, amlodipine is generic, and in some places, some Publix pharmacies, that's Publix, Publix, they literally give it away for free. So it is a very good, well-functioning drug that doesn't cost a lot of money. And most patients are on a combination of those two. They're on one or the other or both to control their blood pressure. And people say, how many blood pressure medicines do I have to take, Dr. Collier? As many as it takes to control your blood pressure. Lowering your blood pressure, but not getting you to a controlled level has no benefit to you as far as preventing heart attacks and strokes. So the average person takes 3 to 5 medications to keep their blood, to lower the blood pressure and keep it controlled. The objective is to put you on 3 to 5 medications that are one, compatible, that don't fight each other, that actually work together. So you got one blood pressure medicine lowering your blood pressure this much, and another blood pressure medication, and together they lower it more than either one by themselves, versus medications that can compete for each other, and they can do that. And that is a big problem when you have multiple doctors trying to treat you. You can have a kidney specialist or a nephrologist, a cardiologist, and a primary care doctor like a family physician or an internist, and everybody's giving you different medications. The left hand doesn't know what the right hand is doing. So you need a quarterback, somebody who you designate as the person that's going to be in control of your blood pressure treatment options. And then making sure they can coordinate with the kidney specialist, they can coordinate with the cardiologist if you need those specialists. But you need one person handling those medications so that you get the best benefit with the fewest number of drugs with no negative side effects like erectile dysfunction. Great question, Chili Will. Thank you. That's your first question, I think. Okay, Deborah Matthews, are there any negative side effects to the products on the kidneys? No, none of the products that we have stimulants in them. They don't have any negative effects on renal function. If anything, they have positive benefits, particularly most of the issues with the kidneys are inflammatory in nature. And our two biggest things that I recommend are the vitamin D at 5,000 international units and the omega-3 fish oil, which are both great anti-inflammatories and in combination decrease inflammation, which helps with a variety of disease processes like high blood pressure, like diabetes. All of these things are inflammatory disease states. So if you have kidney issues proper, you want to, one, decrease your body fat. That decreases your weight, which decreases the stress on your kidneys from trying to filter all the blood, which is detoxifying you and removing bad things. So you want to optimize your kidney function. So things that I also like, probiotics, amazing benefits as far as your GI function is concerned, your kidney function is concerned, and preventing and controlling allergy and allergy symptoms like sinusitis, allergic rhinitis, asthma, and eczema. All these things are inflammatory conditions. And when you have inflammation anywhere in your body, it causes inflammatory problems in your kidneys. So you want to keep general inflammation down. So to answer your questions, Deborah, no negative side effects from any of the products on the kidneys or the heart or the brain or anything like that nature. The only issue that was a concern, and this was brought up by a patient, the omega-3 fish oil, if you're allergic to fish. And so there are other omega products that are non-fish based. Our product is fish-based, so if you have any problems with fish allergies or you can't tolerate seafood, then you can't take our omega-3. Then there are products like flaxseed oil that are plant-based that you can take. And they're also good omega-3s in flaxseed oil. Okay, but if you have no issues with seafood and you can eat fish and shell, that's including shellfish and regular fish as well, shrimp, all those things, no problem. Then the omega-3 our omega-3 is the lipo omega is a good product for you as well. Okay, Deborah, great question. Janice Turner, hey Janice, how are you? Can liposhroom be taken with lipoimmune, or should you take only one of the products? They are complementary, particularly if you have some autoimmune issues. then all immune issues. You have bad allergies, you have bad asthma, you have bad itchy skin. The combination will be greater than either product individually. The lipoimmune product has the things in it that can help prevent things like respiratory tract infections. So we came up with the lipoimmune at the beginning of the COVID. Before there was a COVID vaccine, you needed to optimize your body's immune function. So the lipoimmune has the elderberry, it's got zinc, and it's got vitamin B. Those things are all great for boosting your immune system. Liposhroom boosts your immune system by a totally different mechanism. So the two things are cumulative. So if you are susceptible to infectious diseases, particularly viruses, fungal, or bacterial, then taking that combination will probably give you greater benefit than taking one or the other. So, but if you have more problems with infectious diseases, the liposhroom will probably be a good choice. But if you're concerned about the cough, cold, flu season, the coronavirus or the COVID, if you have not taken the shots, then you definitely need to be on something to optimize your immune function. So an optimal immune function combination would be the liposhroom, the lipoimmune, and the Doctor's D, the vitamin D product. Those three things give you basically everything you could have to optimize and maximize your immune system function. Doesn't mean you won't get sick. Nothing protects you 100%, but it definitely, even if you did get sick, the degree of illness should be minimal versus, basically laying you out. You say, I had a little runny nose and I got over it in 24 hours versus I was laid out for a week with the flu. That's going to make a major difference in how you go. Okay, great question. Let me get a sip of water. R2, next question. Patrick White, okay. Doctor, what do you have for people with eye problems? Well, it depends on what kind of eye problem you have. Most of the problems with eyes can be inflammatory in nature. So once again, the omega-3 fish oil is a very good product, but there are other vitamin supplements that are amazing for people with retinal problems or, they're starting to lose their vision from the inside, not from cataracts. Cataracts basically block your vision, give you blurred vision because they're literally blocking the hole, the iris, where the light comes through and goes to the back of your eye where the retina is, which interprets those lights and gives you what you're actually seeing. Your brain interprets those retinal symptoms or signals, those retinal signals, and you see what you're seeing, whatever that is. So eye problems are a little more complicated. We could be talking about something as minor as increased pressure in the eye, glaucoma, where you can decrease that pressure, or other, retinal diseases. So degenerative and detachment of retina is a big problem, but the primary therapy for some of these disease states is vitamin products and supplements. And so one of the pharmaceutical companies realized this. They took a vitamin supplement, isolated it, and renamed it, and basically charge you, 100 times worth what you could get from the same vitamin over the counter. So this is something, but an eye problem, you do not want to lose your eyesight, Patrick. So you want to decrease the inflammation. So again, vitamin D at 5,000 international units per day, omega-3 fish oil, and then you might benefit from probiotics as well. But then also, if you have to take eye drops from the eye doctor, then whatever it takes, but you want to do whatever you can to optimize your eye health. So these things would be in addition to, not instead of. All supplements are that. I tell my patients that these are not alternatives to prescription medication. If you have been given a prescription for something, you need to take that prescription medication. These are in addition to. They will hopefully make the prescription medication work better or improve your response to it, and or slow the deterioration of a disease state. For instance, diabetes is a disease that worsens over time no matter what you do. Now the question is, are you going to go down like this slowly over time, or are you going to start here and nosedive? That is what you want to prevent, and that's why taking your prescription medications along with supplements that give you benefit can optimize your health. And that is our objective, to optimize your health. We want to improve bad health, we want to prevent diseases when we can, and that's what we want to do. But we also want you to have a little fun. That's why we have the Lipo-HERS to improve a woman's sexuality, and the Lipo-T to improve a man's sexuality. Dr. Collier is one, and I told you that. I take the Lipo-T every day, and Mrs. Collier is glad that I do because it definitely is an enhancement to function. And so at the demand, of people that were hearing about the lipo tea and other products. We want ours. The lady saying we got to have something that matches that or gives us the wham bam too. We want the fire back. And then we came up and developed the lipo hers product. So all of our products, everything on the website is at special sale prices right now. Black Friday sale prices, just like everything else in the world nowadays, but you can get it tonight. You can get it tomorrow. You can get it throughout the rest of the weekend. Get your special Black Friday pricing on every item that's in the Lipo Drops line. You can get it. So go to the Lipo Drops website, lipodrops.com, and we want to make sure that you are enhancing your life and optimizing your health. Again, we don't want you to gain 15 pounds over the holiday season. At minimum, we don't want you to gain any. Optimally, we want you to lose. Don't wait until January to jumpstart. You want to look good now. You want to look good when you go into these parties. You want to also function better. You want to be able to tolerate extra food, extra drink, again, in moderation. But remember the rule that Dr. Collier gave you. Whenever you're drinking anything other than water, you also get a glass of water. You're going to be shocked at how simple that is and how well it works. And drinking that extra water, without question, will help get food through you and help you lose weight, because you'll have a sense of satiety. Your stomach will be full of water, which has 0 calories, and you won't eat as much. And so you will find that I tell people, I can get weight off of you. If you just drink an extra glass of water a day and do intermittent fasting, you will lose weight. You don't have to do anything else. But if you want to lose more weight and you want to lose weight quicker, then you take some of the supplements that we talk about, like our Lipo Drops Maximum Strength Formula and the Lipo Nights. How was the Lipo Drops Maximum Strength Formula developed? Well, the original parent formula was Lipo Drops, and it worked wonderfully. Patients were taking it, they were losing weight. And you know how some of us are. We say, okay, well, if 1 dropperful does good, let me take 2 dropperfuls. And if 2 dropperfuls make me lose more weight, let me take 3 dropperfuls. So people would call me or send me emails and or DM me and say, Dr. Collier, I'm taking extra Lipo Drops. I'm running out of it, 1, which you would do. But 2, is that going to harm me in any way? And so Dr. Collier said, well, guess what? I don't know. Let's find out. And so what we found out was that we could optimize the amino acids that are in the Lipo Drops. We increased the formulation by 500%. And what we got from that was the Lipo Drops Maximum Strength Formula. So probably no additional benefit from increasing the dose on that, but the dosing range is simple. You can take 1 dropperful before 1 meal, your biggest meal of the day, to lose weight. Or if you want to lose more weight quicker, you can take 1 dropperful before each meal. 1 dropperful before breakfast, 1 dropperful before lunch, 1 dropperful before dinner, and you will lose more weight. And then people say, okay, I finished eating. I feel still a little bloated when I go to sleep. I'm having difficulty sleeping. Then we got the Lipo Drops Nights. Now, the Lipo Nights has, in addition to other things that help your body metabolize fat overnight while you're sleeping, literally while you're sleeping, we also put some melatonin in there so you get a good night's sleep. Because if you do not get a good night's sleep, you increase your cortisol levels, which increases, it changes fat metabolism and increases particularly your abdominal fat, which is the worst place to gain weight. And it's the fat under your belly, not the fat that's on top of the muscles. And it's the fat behind that. So that increases your risk for a cardiovascular event like a heart attack or a stroke. So you get a good night's sleep with that melatonin, the cortisol levels go down, you lose the weight from the places that you want to lose it from, particularly the abdomen, and you find that things have been going wonderfully. You say, wow, this is amazing. I really like what's going on with that. So there we go. Okay, so we are here and we are live in our temporary studios. I want to thank each and every one of you for joining us tonight. I know everybody's a holiday season, and we were discussing with our production team, would people want to come when they tune in on Wednesday night before Thanksgiving? And you have showed me that you have. That makes it worth it for me to take the time to prepare, to get the information that I need to do so I can answer your questions. And again, this is infotainment. We want to keep you excited. We want to keep you entertained. We want to also optimize your health. This is the only place, the only interactive healthcare forum that allows you, the listener, to call, text, write in, and ask your healthcare questions. So thank you for joining us now. This brings to a close this episode of the Ask Dr. MJ Facebook Live production. We're here to answer your healthcare questions. We are here on the holiday season. We want to thank you for joining us in our temporary studios. Next time, we'll be back in our regular studios, and we'll have a broadcast that you can be proud of. Tune in. Tell your friends.
Tomorrow, when you're at your dinner table enjoying Thanksgiving, discuss your family's health. What are the disease processes that are affecting you? What did grandmama die from? What did granddaddy have? What was the type of, is there cancer that runs in your family? Is everybody diabetic? Do you have, people have kidney disease? Is someone on dialysis? These are things we want to know. And then tell everybody to tune in to the Ask Dr. MJ Facebook Live, Instagram Live broadcast every Wednesday at 6:30 p.m. Eastern Standard Time. We appreciate you. Thank you. We're out, and have a happy Thanksgiving. Go to our website, lipodrops.com. 65% off Black Friday pricing on all lipo products. Thank you so much. We'll see you next time.